Clear? Okay. Now, you all know about these terms. We have discussed multiple times. IPC, CrPC and Indian Evidence Act. Now these have been replaced by these terms BNS, BNSS and BSA. Invariably this will be asked. What do you mean by BNS? What do you mean by BNSS? What is BSA? Because these are new topics. New topics in forensic medicine, so they will be more interested to know about this from you. Okay. What about these terms? Injury, violence, assault, abuse, harm, trauma, wound, hurt, battery. This 9th number term is something new for you. Remaining terms, suna hoga kabhi na kabhi. Injury, violence, assault, abuse, harm, trauma, wound, hurt. These are familiar terms to you. Battery is something new. Out of this 1 and 8, injury and hurt. तुम लोग कुछ भी books पढ़ो, no photos. Hello. You are not allowed to take photo. Injury and hurt. Okay. Whatever books you are following, that definition will be same in all the books. Because this is defined in law. Injury ka definition is any harm whatever illegally caused to a person in body, mind, reputation or property, defined in 44 IPC. Now you will not use IPC, you will use BNS. Section 2, subsection 14 of BNS. Okay? So each word is important. You cannot change any word in this one. So what is harm? That harm has to be illegally caused to a person. That means human being. So that harm has to be illegally caused to a person in his or her body, mind, reputation and or property. In exam, do not say and property. Many of you might do this mistake. You will say body, mind, reputation and property. It is not and. It is or. Any of these four. Body or mind or reputation or property. It's something like this. Clear? We as forensic person, we are more concerned with body. Mind, reputation, property is not our domain. This will be dealt by other experts. We will deal with any harm whatever illegally caused to a person in his or her body. We as forensic medicine, we are examining body. Okay. There are many good institutes in India where they have this clinical forensic medicine department. Any trauma patient, any accident, any sexual assault, any abuse, any poisoning case, when it comes to those institutes, forensic medicine department will go and check the patient. It's like other clinical departments. Okay? So that is injury. What is hurt? This one, bodily pain, disease or infirmity caused to a person. It is defined in 114 BNS. You follow any book, this definition will be same. The other definitions may be different. Okay, different authors will have their own definition. Whatever is there in your book, you follow that. It's good if you remember all, but you must remember hurt and injury because these are legal definitions. Clear? Sometimes they used to ask, tell me what is the medical definition of injury. Medical definition of injury is nothing but wound. Wound. This one you will get in surgery department also, surgery book. What do you mean by wound? Any break or breach in the natural continuity of tissues in the living body. That is known as wound. Okay, so that is the medical definition of injury. Legal definition of injury is this one. Now what do you mean by battery? Battery is you are causing harm to someone by physical touch. Suppose I have slapped someone, physical touch. That injury, as I told you, that it may be body, mind, reputation or property. If I scold you, If I scold you every day, that will be a kind of mental harassment. You might say that I am mentally torturing you, right? But that is not a battery. If you complain that I have slapped you or I have kicked you, that becomes a battery. Physical touch. Okay, a criminal offense whereby a person makes unlawful physical contact with another, it is a battery. Did you hear the term battered baby syndrome? Battered baby syndrome till now? No. Battered wife? No. Battered baby syndrome is another name of child abuse. Child abuse. When a child is physically abused, continuously slapped or kicked or by any physical contact, that is known as battered baby syndrome. Battery, battered. Battered wife means what now? Battered wife means a wife who is physically abused. Okay? Battered wife, battered baby. Like that you may have battered husband, battered boyfriend, battered girlfriend, battered your grandfather, grandmother, like that. Okay? Battery. Now this is the classification of injuries. May come as a long question, a part of your long question. There are various ways of classifying the injuries: medical classification, legal, and medico-legal. Medical classification is the chapters which are there in your book. When we communicate with one another, abrasion हुआ है, या laceration हुआ है, stab wound हुआ है, these are all medical terms. When we communicate with one another, medical classification. Legal means what the court will say. Court will not see whether this is an abrasion, bruise, laceration or what. Court will say, suppose I have physically assaulted someone. Court will say whether that injury which I have caused, is it simple or serious? Okay? If it is simple, then the punishment is less, that is hurt. Look here, hurt. If it is something serious, that becomes grievous. So court will see whether that injury which has caused illegally to a person by another person, is that injury simple, that is hurt, or grievous, that is serious. For this, the punishment is more. For that, the punishment is less. Where is it defined? 116 BNS. There are multiple clauses. One has to prove that it is a grievous. Now, suppose being a teacher, you are not, I am irritated by you. There are many incidents like that. So, I didn't like you for not coming to class or not giving this one homework properly. So, I have slapped you very badly. Now, because of that, what happens? That your eardrum got punctured. Okay, because of the slap, this got punctured. You can file a case against me. And that is a grievous hurt. This one. Okay? 116 BNS. There are different clauses. We'll discuss about this in theory. But put this as 5-star. Definitely you will get question on grievous hurt. Practical, viva, long question, short note, anything you might get on grievous hurt. What is medico-legal classification? It means it may be suicidal, homicidal, accidental, self-inflicted, defense, iatrogenic. Suicidal means what? I want to commit suicide, I have done something to myself. I have used a blade, I have cut my wrist, that becomes a suicidal wound. Homicidal means, yes? Murder, I want to kill someone. Okay? So, that injury which I will produce becomes a homicidal injury. Accidental, you know by this term, accident. Self-inflicted. Self-inflicted means? Just to hurt myself, yes. To hurt myself, I can injure this one. Another thing can be self-inflicted or fabricated. I want to file a case against my ex. Okay, I will say that she used to abuse me. She used to threaten me and she used to physically torture me. So what I'll do? I'll take a blade, I'll cut my hand and I'll say to the court that this has been caused by my ex. Okay, so that is self-inflicted. Defense. You came to hit me. I'll not simply stand. I'll try to defend myself. So in that defense, I'll have some injuries in myself. Right? So that becomes a defense wound. What do you mean by iatrogenic? Not really, drug-induced. Yes, to some extent correct. Iatrogenic means due to medical intervention. You got a patient or an autopsy where you see multiple needle marks on the body. It may be due to drug abuse. He is a drug addict. Or he may be admitted in hospital and he was given medicine. It depends on the location also. So because of therapeutic intervention, there may be some injuries. Okay, accident case. Here there is a injury inside. Pressure is increasing, so they have to make a burr hole. So that is an iatrogenic injury. Okay, so because of medical intervention. So this is medico-legal classification. Sorry? No, why this is not for medical intervention. What is the difference between drug and poison? Drug is something which you will use to save the life. Okay, if the drug is given in little or in excess and intention to harm someone, that becomes a poison. Okay, now if with food you are giving drug, okay, so that will be for the benefit of the patient. But with food, if you are giving that drug in excess, the best example I'll say is there's a insulin. Okay, a diabetic patient, he is taking insulin. Now you inject more insulin in that person will die because of hypoglycemia. Okay, so that becomes a poison. But insulin as such is a drug. Iatrogenic means that any injury which is caused due to medical intervention. Sometimes we may have to explore. Say I have many autopsy cases where person died because of some after surgery. Say he was stabbed. He was stabbed here. This is the stab wound here. Now he was taken to hospital. They have done the suturing. Okay, and then they have seen that the heart is punctured. So they will do some intervention in the heart also. Now, if I don't have this history, now I have got this patient as in autopsy. How will I know that this is caused by doctor or this is done by a random person? Because this has already been stitched or this has already been altered, which I am saying. You are getting my point? I need to know the history for that. So there will be many injuries which you will come across or wound you will come across which is not due to any illegal activity. It is due to medical intervention. That becomes an iatrogenic. Is it clear? Anything else you want to know? We have got one case. We got a call from ENT department. There was a case of gunfire. Then we got a call. There was a clash between Assam and Meghalaya, and there was a few people started to attack each other, and there was problem with I think some related to this forest or something, and there was gun firing, and one of them got hit with a bullet here in the jaw, and then he was taken to hospital. Then ENT department gave a call to our HOD sir to go and check the patient. We went, That time we could not do anything. We cannot examine the injury because he was already managed. Intervention was done. Bandage laga hua tha idhar. Now I will not go there and open the bandage and see what is that injury because इसमें already stitch किया हुआ है, इसमें already medicine डाल दिया है, इसमें already bandage दिया हुआ है. So how will I open the stitch and then see what is that injury? It's of no use. That is an iatrogenic wound. Becomes an iatrogenic wound. Now, इसमें क्या हुआ था? Here is one injury. Here is one injury. So the person told that जो bullet है इधर से घुसा इधर से निकला और इधर से निकला अंदर घुसा इधर से निकला. But shockingly, what we saw that मुंह के अंदर everything is okay. So how is it possible? Later on, what we found out that it was not entry and exit. It was a bullet which just ऐसे घिस के गया skin से, glancing bullet. Okay, it did not enter the body. And ये वाला जो था, he fell down on the street. Okay, and he got hit on the road here. And it was told that इधर से घुसा इधर से निकला. This was not because of that bullet. This was because of that blunt impact. Okay, so that is not an iatrogenic. This becomes an iatrogenic wound. Clear? Okay, mechanical injuries. Medical classification. Mechanical, you will have one chapter. Thermal, you will have one chapter. Chemical, you have chapter. Physical agents injuries, you have one chapter. Right? Mechanical, you might get as a short note, classify mechanical injuries due to blunt force, due to sharp force, due to piercing object, due to firearm. You must remember this classification. Blunt force के लिए there can be abrasion, contusion, bruise, laceration, fracture. Due to sharp force, it will be incised or chop wound. Due to piercing object, stab wound. In your book, if it is written that stab wound is because of sharp, then this is wrong. I don't know what is written in your book because sharp force, a blade is also a sharp object. But can you stab someone with a blade? No. But you need a knife or a pointed object. Okay, so in most of the books, sharp force may they have put stab also. That is wrong. Sharp force doesn't mean that it will be used for stab. For stab, you need a piercing object or pointing object. Okay, and this is due to firearm. I was supposed to take this today. This were taken in the last 2 classes. In short, I'll show you about firearm today. Thermal, it may be due to heat, it may be due to cold. Anything which comes to your mind because of heat? Burn injury. Burn injury is because of dry heat. Moist heat may? Anything? What do you mean by moist heat? Steam. Water. Hot water. I throw hot water at someone. That person will have what injury? What is it called? Burn, but the name is different. It is known as scald. Scald injury. Okay? Similarly, cold. Not only this, you have heat stroke. Heat stroke होता है heat के लिए. Heat hyperpyrexia. Because of cold also you have hypothermia, frostbite, frost nip, French foot. All these are example of injuries due to cold. Then due to chemical, it may be acid, alkalis, salts. Physical agents matlab you have in your curriculum for electricity, injuries caused by electricity, injuries caused by lightning, injuries caused by radiation. Okay? So most of your chapters will be this one in traumatology. So we'll go one by one. As I told you, details we'll study in theory. Your job is to just identify the injuries. This is an example of abrasion. All of you have experienced abrasion in your life, right? This is destruction of the superficial layer, epidermis, or the mucous membrane caused mechanically by blunt force impact. Superficial layer, only the epidermis is gone. And In exam, if you write till this much, destruction of the superficial layer of the skin or mucous membrane, then you will get half mark. You have to mention this line. Why? Because burn injury जो होता है, when we will discuss burn, there one of the classification is superficial burn, first degree burn. Superficial burn is also having almost the same definition. First degree burn. First degree burn is something like you touch a hot say vessel or hot oven, then you will have some injury that is limited to your epidermis. So that is also injury involving the superficial layer of the skin, but that is caused because of heat, burn. This is not because of burn, this is because of blunt force. ठीक है? There are many classifications. You remember the name? It may be grazed, it may be scratch, pressure, impact. There are different names. Book में लिखा है. Go through those names. Each of them are short notes. Scratch abrasion, grazed abrasion, pressure, impact. Scratch, from the name itself you can understand. This is scratch. This is caused due to friction by pointed objects, like something like this, pointed object. Okay? You can use your nails also. Pointed object, nails, scratch karo, that becomes a scratch abrasion, also known as linear abrasion. This one is grazed abrasion. Previous one was a pointed object. This one is a broad surface. This one, suppose I drag someone in an irregular surface, raste mein. So that will cause this one. If I rub my hand here continuously, this is an irregular surface, broad, so my hand will have this grazed abrasion, friction against a broad surface. Where will you see this mostly? In which type of incident? Road traffic accident. Very good. So this is a viva question. Where will you see this type of abrasion more? Road traffic accident. What is this? Pressure abrasion, okay, but what do you see here? This is what? Ligature mark. Okay, whether this is of hanging or strangulation, that is not your job now. We'll know the differences between hanging and strangulation in the theory class. For now, you see that this is a ligature mark. Okay, this is of hanging. Here, this is an example of pressure abrasion. Now, what do you mean by pressure abrasion? Here, the duration of the force is more than the pressure of the force. That means a small amount of force is there for a long period of time. So that becomes a pressure abrasion. The person, I remember like that, the person jab hang hoga, it will be for very long period of time. So the duration is more, the pressure is less. This is pressure abrasion. Reverse socho, duration is less, pressure is more. Anything which comes to your mind? A very heavy thing for a short period of time. Tire mark, rollover injury, accident में टायर ऊपर से चला गया, duration is less, but the pressure is more. Okay, so the tire mark जो होगा body में, that will be an impact abrasion. Previous one was pressure abrasion. This is an impact abrasion. Okay, here the duration is less, the pressure is more. Here also the pressure is more, the duration is less. This abrasion caused by the gun. This is the surface of the gun. Because of this area. These parts and all we'll discuss when we discuss about firearm. Okay. This which is caused contact wound, contact. Okay. This which is caused. In theory, we will also discuss why this is caused. What is the mechanism of this one? Okay. This is an example of impact abrasion. The pressure is more, the duration is less. Okay. Now, what do you mean by bruise? What do you mean by bruise or contusion? These two terms are almost same. Okay, this is effusion or extravasation of blood into tissues, something in the middle. Okay, either of these two. Why it occurs, this effusion, why it occurs? Because of rupture of blood vessels. Why there is rupture of blood vessel? Because of blunt force. So there will be some effusion of blood. Because of what? Because of rupture of blood vessels, small blood vessels. Why rupture of blood vessels? Because of blunt force. अभी ये effusion of blood कहाँ जाके accommodate होगा? If it is underneath the skin, that becomes a bruise. This one. If I beat you with a bamboo, blue color होगा कि नहीं? That area, that will be a bruise. Okay? If it is in other tissues and organs like muscles, lungs, heart, brain, then it becomes a contusion. So what we see from external, it is a bruise. Internally, check करने से it is a contusion. So there is an accident. Say accident हुआ है. Then the person will move forward. Steering will hit the chest. So externally you might see a bruise. Internally there might be contusion of the heart. You will not say that the heart is bruised. You will say the heart is contused. Brain में होने से the brain is contused. Okay, this is contusion of the brain. This is contusion of the neck muscle, seen in strangulation. Okay. This is an example of bruise. Okay. This is an example of pattern bruise. What is this? Pattern bruise. Pattern means what? You get the pattern of the striking surface, striking weapon. Pattern. इससे क्या लगता है? What may be the weapon? What do you think? डंडा टाइप कुछ एक होगा. डंडा टाइप इधर हिट किया है. Because of which you see there is here there is bruise, here there is bruise. In the middle there is a gap. Did you see? Back side, पीछे जो बैठे हैं वो लोग. Could you appreciate? Here there is one bruise, here there is one bruise. In the middle there is one gap. Here also. There is bruise, there is bruise. Here there is one gap. What structure comes to your mind? Bamboo weapon. मतलब structure क्या होता है? ऐसे line, middle में gap. Railway track देखा? This is known as railway track bruise. Tramline bruise. Mechanism we'll discuss in theory, but you remember the how does it look? Tramline bruise or railway track bruise. It gives us the idea of the striking object. Okay, why there is a gap here? Why only this part is bruised? Why not here? What is the mechanism? Theory. But this is how tramline bruise looks. This is another thing, medico-legal importance. From the color, we can identify the age of the wound, age of the bruise. Okay. For now, it's no need. Okay. So now, what do you mean by 2D injuries? 2D मतलब क्या है? Two-dimensional. You have the length and the breadth. From now onwards, all these injuries will be having depth also. Length, breadth, and depth. Length, breadth, or length, breadth, and depth. 2D injuries will be abrasion and bruise. You will measure only length and breadth. Laceration, incised wound, stab wound, you will measure not only the length, breadth, and also the depth. Okay. Now, one point I forgot to tell to the other batches also. In living patients, how will you measure the depth? In living patient, dead person के लिए is easy. In living patient, how will you measure the depth? ये तो अच्छा ठीक है, तुम measure कर सकते हो. It is there on the surface. You will get maybe measuring tape. But will you introduce that measuring tape inside the wound? That is a foreign object. Okay, you will introduce more infection. So you will not introduce the measuring tape and say that this is 2 centimeter or 3 centimeter or 4 centimeter depth. You will simply say whether it is subcutaneous dip, muscle dip or bone dip. Okay, do not introduce the measuring tape in the wound and measure the depth. Okay. Now, laceration, incise or stab. In this picture only I can make you understand. Simply, laceration, the margins will be irregular. You see, the margins will be irregular here. In incise, clean hoga, clean cut. Okay. In incise, the depth is less. The length will be more. In incised zone. Incised zone. In stab, the depth will be more. Okay, length will be less. Viva question. Which is the greatest dimension in an incised wound? Length. Okay. Which is the greatest dimension in a stab wound? The depth. So laceration is tear or splits of skin, mucous membrane, muscle or internal organs produced by blunt force. Abrasion is caused by blunt force. This side, जोर से बोलो. Abrasion is caused by blunt force. Bruise is caused by blunt force. Blunt force. Laceration is caused by blunt force. Incised by sharp. Stab by piercing object. Piercing or pointed object. Okay. This is an example of laceration. Okay, this is an example of laceration caused by blunt force. Here, shape may be irregular. Gapping will be there. What do you mean by tissue bridge? Tissue bridge means that there is a gap you see. Okay, some of the skin or the tissues will be like bridges. It will be connected to one another like this. Okay, that is known as tissue bridge. This is typical for laceration, not for incise or stab. Here you may not see because it's a 2D picture, it is difficult. In reality, you may see some tissue bridges. Then hair bulbs and vessels will be crushed because it is by blunt force. Okay, blunt force से कुछ मारने से this will be crushed. But if you are using a knife and hit someone, the hair bulbs and the vessels will be cut. But here it is crushed. Okay. Different types: tear, split, stretch, cut, avulsion. Remember the name and how does it look? Where will you see? Tear, laceration, you will see when you will get the injury in an area where there is sufficient amount of underlying fat and muscle. There you will get tear. If someone hits me with a bamboo here in the abdomen, most likely I'll have tear laceration. Sufficient amount of underlying fat and muscle. So here, thigh, you will get tear. Now split is something where you are applying the force in a place where there is minimum amount of underlying fat and muscle. Like your here, face, head. You hit someone with a bamboo on the head, it will be something like this. This is known as split laceration. Other name is incised looking lacerated wound. Okay. Now, incised looking lacerated wound means that this is a laceration, but it looks like an incised wound. Why I am saying this is laceration? Because it is caused by blunt force. It is not by sharp force. So this is a laceration, but it looks like incised because it is in a place where there is minimum amount of underlying fat and muscle. How will you differentiate? Short note. How will you differentiate whether this is a true incised wound or a laceration? Use a magnifying glass. Tissue bridges will be there. Margins will be something irregular. Okay, and hair bulbs and the vessels will be crushed. Okay, that is the difference between true incised wound and incised looking lacerated wound. Star mark though, agar if you are writing somewhere, short note. And where will you see this incised looking lacerated wound? Stretch wound, stretch laceration is not that important. Just you see that the skin will be overstretched and it will result in a flap. Okay, it is the impact in such an angle that the skin is overstretched and there is a tear and it has resulted in a flap. Cut laceration. Cut laceration, you take a dao, strike on the head of a person, that is a cut laceration. That one, that is a cut laceration. For this, you need heavy cutting weapon for cut laceration. You cannot cause that one using a blade. It has to be a heavy cutting weapon. A blade will cause an incised wound. But this one, heavy cutting weapon is required for a cut laceration. What do you mean by avulsion?
Piece of tissue is
taken out. Okay, the skin will go out. Okay, and it will be caused if there is any grinding compression of a heavy weight. Tire mark, tire जो होता है, tire, if it is there in your skin, okay, because of the high pressure of the tire, of the moving tire, that skin will come out and it will cause avulsion. ठीक है? Incised, now you know, clean cut wound through the tissues caused by sharp edge instrument, weapon or object. Okay, incised wound. If someone asks you what is the mechanism of incised wound, three mechanism: doctor, butcher, carpenter. How you give the incision?
pen.
Like a pen. Try करो सब लोग. Painting कैसे करते हो तुम लोग? Like this, right? So that is a surgeon. Drawing is a mechanism. Okay? Butcher, striking. Like this. Chicken काटते हुए देखा है? How they cut? That is a butcher. Striking. You take a knife and hit someone like this. That is a butcher, striking. Carpenter is sawing. You take a knife, try to cut the neck of someone like this. Carpenter, sawing. Striking and sawing. Now if this striking is in perpendicular direction, it becomes a chop wound. If someone wants to cut my hand, they want to remove my limb, so एक दाव लेगा, लेने के बाद ऐसे काटता रहेगा, right? Like this, perpendicular. So that is a chop wound. What do you mean by beveling? We'll discuss in theory. Okay, beveling. Acute angle पे करना होता है, oblique angle पे. But for now, you just remember the mechanism: drawing, striking, sawing. Clear? Okay. Now, here, incised wound, it is clean cut, and one very important feature of incised wound is this tailing of wound. What is the importance of tailing? Short note. How does it help? You can guess what is the direction of the wound? Something like this, right? इधर देखो सब लोग. What is the direction of this wound? Something like this. So tailing of wound is at the end. One example how it helps. if I want to commit suicide by cutting my throat, I take a knife and I will cut my throat. I have a right-handed person. Where will be the tailing? Right side. If I am left-handed, this side. Okay. Now, if I am right-handed and the tailing is still on the left-hand side, so some locha has. There is some problem. Okay. I want to cut my wrist. So where will be my? I am a right-handed person, so I'll try to cut my wrist here. So where will be the tailing? Okay, medially. Okay, right? Medially. So there are many more ways to find out whether it is homicidal or suicidal. One of the feature is tailing. We have to identify the tailing. Stab. It is a deep wound produced by a pointed piercing end of a weapon or object entering the body. This one I will give you a spotter. This one. Spotter. These are all stab wounds with different names. This one is punctured wound, introduced into the skin. This one has entered the cavity, that becomes a penetrating wound. And this one is perforating, through and through. So punctured, penetrating and perforating wounds. Okay, this one, just in short, maximum dimension is depth, bol diya. Okay, the margins, if it is a knife, sharp, okay, then it will be incised step, it will be clear, it will be clean. But if I am using a screwdriver, that is also pointed, but that is not sharp, right? Screwdriver, cricket stump, then it will be a contused stab. Idhar dekho. It will be contused stab. Sharp edge hone se inside stab, rounded edge like a screwdriver or a stump, it will have contused stab. Not that important for you to remember. Important is this one, shape. Shape. Single edge and double edge. What do you mean by single edge? This is only sharp. That is a single edge. If both are sharp, that is a double edge. Now what happens that if it is a single edge, the shape is teardrop, raindrop, triangular, wedge shape. But if it is double edge, then spindle shape, elliptical or slit-like. See, single edge, one edge is sharp. So only one pointed angle, one acute angle, 1, 2, 3. Other end is blunt. If both are pointed, that becomes a spindle shape. That means both sides are sharp. I might give you a long question on this. A man is stabbed, and on examination you have found out that is a spindle shape stab wound. So what could be the probable type of weapon? So you will say double-edged sharp weapon. Okay? Another important point here. What is this called? This part of the knife? Hilt. This is known as the hilt. Why is it given in a knife?
Protect our fingers.
Protect our finger. Okay? So that while cutting vegetable, what is the difference between knife and dagger?
Knife is made for cutting, dagger is made for stabbing.
One is cutting and stabbing. Tum bolo? Another one is double edge. I have knife, vegetable knife, जो both sides से double edge है.
Dagger has hilt.
Knife is not having hilt. Many differences are there. I have not found any specific answer for this one. I have tried to search, but what I personally think, you can find out from Google. What I personally think is with the intention. Okay, knife we use for day-to-day life, day-to-day activities. I will not say that okay, bring that dagger. I want to cut this apple. I'll say that bring that knife to cut the apple. I'll not say bring that dagger to cut the apple. Dagger is something which we think of for protection or for killing someone. So that intention maybe makes the difference. Okay. Yes, somewhere maybe it is written that one is single edge, one is double edge. But it is not that specific. There are many knives where it is double edge. Many dagger where it is single edge. Okay, but what is important is this hilt. Hilt protects us from getting injured, number one. Medico-legally, why it is important that suppose I have fully introduced this dagger in someone's body. Okay, so at one point, this one will be touching the skin, this one will be touching the skin, and this entire thing is inside the body. This hilt will produce this abrasion, this abrasion, and the blade will cause this stab. Now, if we are getting this type of injury, this is important because either say we will get the depth. Okay, depth. Maybe we'll do X-ray, we'll do CT scan, we'll do some investigation, and if it is autopsy, then it's okay, fine. We can understand the depth. This depth is equivalent to the length of this blade, right? Understood the connection? The depth of this is equivalent to the length of this blade. Why I am saying this confidently? Because I am getting this abrasion. This abrasion is caused because of this hilt. So the entire thing is introduced into the body. Of course, there will be some variation because this abdomen ka jo skin hai, this is very laxed. Okay, lax hai, flexible hai. So we have to do some calculation. Ultimately, we will give an idea that this is the length of the blade. We'll give this report to the police. Police will find out that okay, I want to search a weapon which is about 5 centimeter length. The blade is 5 centimeter length. Okay, so this gives us an idea about the dimensions of the weapon. These are multiple shapes for stab. Now, as I told you, your job is to correctly identify the injuries. What is this?
Abrasion.
Which type of abrasion?
Raised abrasion.
Raised abrasion. Very good. What is this?
Laceration.
Why laceration? कहाँ पे क्लीन कट नहीं है? Do you see, this is caused by sharp or blunt? Then how laceration can be by sharp? Sharp edge. Yes. Yes. See, your job, as I told you, is to identify the injury. Okay. Now you will do mistake, but I want why you think this is laceration. One point, as you told, that this is caused by sharp. So obviously, one point is against laceration. Any other point which suggests that this is laceration then? Yes, बोलो. और क्या हो सकता है? Here, book में देख के क्या फायदा नहीं है. Here, what do you think? What are those points which say that this is laceration? What are the points which say that this is incised or stab or abrasion? Abrasion and bruise तो नहीं है. Okay, नहीं है. You will be confused between stab, this one, incised and laceration. This is caused by sharp. Okay. Do you see tailing of the wound? This one you see. This is one tailing. Okay. This one you see. This is one tailing. So this makes an incised wound. Laceration will not have tailing. Whatever you are seeing, this You see the margins here are very clear, clean. Laceration होने से ये बहुत irregular होता है. These things are what? These things are the soft tissues. Inside से soft tissue निकल के आ गया. Okay, these are multiple parallel incised wounds. Multiple parallel incised wound. Direction is like this. So she was a right-handed person. She tried to cut her wrist. Okay. What is this? What are this? This one. These are hesitation mark. Hesitation mark. Okay. You will hear many cases where someone tried to commit suicide, but didn't really want to die. अपने बॉयफ्रेंड के साथ झगड़ा करके just some nicks on the hand. That is an hesitation mark. Okay, that is fabricated. Maybe fabricated. Here, what happened that to commit suicide is not easy. You need guts. So initially, what happens if someone wants to commit suicide? Initially, superficial nicks करेंगे. Superficially करने के बाद one fatal wound. So she was nervous, maybe she was taking a very drastic step. Initially, she was giving superficial cuts. These are not serious. These are not serious. Serious is this one. This has cut the radial artery. This has not cut the radial artery. Okay, these are hesitation cut marks. Okay, multiple parallel incised wounds. What is this? Abrasion, bruise, laceration, stab. What? Bruise भी है, very good. Bruise भी है और laceration होने से depth होगा. इसमें depth है क्या? Abrasion. Okay, abrasion. This is known as. See, there are abrasion, bruise combined करके there may be abraded contusion, abraded bruise, contused abrasion. There are different terms. Okay, theory में पढ़ेंगे हम लोग. But for now, you just say that this is abrasion, and here are some bruises also present here. Okay, what is this? Abrasion, bruise, laceration, stab, laceration. Now you see here the margins are very. See, it's not बहुत irregular है. Okay, which type of laceration? Last वाला क्या था? Avulsion. Okay, skin निकल गया. Skin has come out. So that is an avulsion. This is a sternum. What do you see here? Abrasion, bruise, laceration, stab wound. What? Inside में है, अंदर में है. So that is contusion. The sternum is contused. Understood? Okay. What do you see here? This is abrasion. This is abrasion. Which type of abrasion? Pressure abrasion. Okay. Ligature mark. Ligature mark. It is going. Okay, that one we'll discuss in theory why this is hanging. What is this? Raised abrasion. What is this? Stab. Stab कहाँ से आ गया ये? Yes. Tire mark. इधर पे एक लाइन है, इधर पे एक लाइन है. There is a gap here. See, there is one line here. There is one line here. Middle में there is a gap. Okay. Here also there is a line. There is a line. Middle में there is a gap. Okay. Then पीछे back में. Okay. It was a case of mob lynching. Okay. इधर भी एक है, इधर भी एक है. Okay. In the middle there is a gap. Gap. बहुत बार डंडे से इसको पीछे से मारा, पीछे में मारा. Okay. Tramline bruise. That is a tramline bruise. What is this? This one? It came in your last internal assessment. Scar mark. Scar. This is a scar. What is this? Contusion, bruise. Bruise ठीक है, contusion भी बोल सकते हो. Bruise. Externally देख रहे हो तो it is a bruise. Okay. If ना भी तुम क्या किया, मुंह के अंदर चेक किया, कुछ इंजरी है कि नहीं. If you see the same thing, then you can say that there is contusion in the mouth. Okay. What is this? The length is more or the depth is more? Length is more. So it is stab or incised? Incised. Why it is not laceration? Do you see any tissues which are connecting one another? No. Margins clean है, foreign body कुछ नहीं है. So maybe a knife or a blade has been used to cut. Do you see the tailing? This is the tailing. Okay, tailing of the wound. Here, what are the injuries you expect from this scene? Chop. Any other injuries? Yes? Laceration, chop, laceration, then fractures, very good. Abrasion होगा कि नहीं? Blunt force है तो abrasion हो ही सकता है. Okay. हर एक चीज जोर से लगेगा ऐसा कुछ नहीं है, लग सकता है, एब्रेशन हो सकता है. एब्रेशन होगा, ब्रूज होगा, फ्रैक्चर होगा, देन क्या बोलते हैं इसको, चॉप वुंड होगा. स्टैब इज नॉट पॉसिबल बिकॉज इट इज नॉट ए पॉइंटेड ऑब्जेक्ट, ही इज यूजिंग एन एक्स. फायरआर्म इज नॉट पॉसिबल बिकॉज ही इज नॉट यूजिंग अ गन. So I might give you this as a spotter and I might ask you, give those injuries which are not possible in this scene. So, देखो, find out. Which type of injury he is creating here? Carpenter. Very good. कौन सा injury? Incised. 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 One of the mechanism was carpenter. Okay, this one. So, that is incised wound. This one will be perforating wound, stab wound. Okay. So every day you will hear news of injuries. Chop body with grinder. Now you know what you mean by chop wound. Now you know what you mean by sharp cutting weapon. Okay. Then what do you know? Now you know what you mean by cut bodies into pieces. You have heard about this incident? I don't know whether you have heard or not. This person was very happy in Holi. He was drunk and he was so happy. He had a knife in his hand. This one, and he started to stab himself because he was very happy. And he stabbed himself, I think 22 or 23 times after getting drunk, and he died. Now why this is interesting for me, because when you get a case with 22 or 23 stab wounds, what do you think? That someone else could have killed him? But this one was not homicidal, this one was accidental. Okay, he killed himself by stabbing. Okay, now come to the firearm. Firearm injury means an injury caused by high velocity projectile. Projectile means either bullet or pellet. If it is a rifle firearm, it is known as bullet. If it is shotgun, it is known as pellet. Now, what is the full form of AK-47? K stands for Kalashnikov. Okay, 47 means? Is there any other AK then except 47? There is a series AK ka. Okay, this was there in this movie AK-47. Try to find out what do you mean by AK-47. Full form क्या है? All firearm injuries will be medico-legal cases. That means you have to inform to the police your job. See, in book, it's a very complicated chapter, but very important. You don't have to study all the things which are written in your book. Your job in firearm injury is to save the life first. Second thing is to record the injury. Record the injury. उस इंजरी से क्या मिलेगा? नंबर वन, डिस्टेंस, कहाँ से फायर हुआ, द रेंज ऑफ फायर. सपोज ही इज शूटिंग मी फ्रॉम देयर. Okay, I'll have some features in my body which will say that this I was hit or I was shot from this distance. Okay, there will be some features in my body which will say that I was shot from this angle. So this was the person standing there, and this person has shot me. Someone is standing there, okay, and then shot me. So I'll have different features of those injuries. Okay, and the angle also will be different, entry and the exit. Your job is to find out the angle, entry and exit, to examine, to get the range, and if you get the bullet inside the body, how will you take out, how will you preserve, how will you hand over to the police. That is your job. And gunpowder agar hai haath mein, how to lift up the gunpowder. ठीक है? That is your role. Parts I'll discuss later on. Classifying of firearm. Classification, there are various ways of classifying firearms. This is the barrel. Barrel of the firearm. This one. This is the barrel. Okay? Now barrel के अंदर, this is known as rifling, lands and grooves, irregular structures. This is rifled firearm. Rifle. If nothing is there, smooth. This is smooth bore. This is rifle. This is smooth bore found in shotgun barrel. ठीक है? Then one classification is how you handle the gun, how you shoot. One classification is on basis of the number of barrel you have, number of barrel. Another way of classifying is this one. This one is a bit important, you should know. Brake action, lever action, bolt action, pump action, semi-automatic action, automatic action. You must have seen that revolver. Okay, revolver is something like this, right? This one, you have to open it, put the cartridge, load it, revolve, and then shoot. Okay, this is what you see. He is shooting and then bolt and then again shooting. This one is pump action. Now semi-automatic means what then?
Semi-automatic, after every bullet you have to press the trigger again. And in automatic you can hold down the trigger and it will fire.
It will fire. Machine gun example. Okay, here you see after every bullet the person has to again prepare the gun. That is known as cocking of the gun. You shoot the bullet, do the rifling again, and then you have to shoot. Here also same. Semi-automatic means you don't have to prepare, you don't have to cock. You pull the trigger, one bullet, again you pull the trigger, another bullet. That is semi-automatic. Automatic means you pull the trigger, automatically multiple bullets will go out. That is automatic. Okay? This one they might ask. Rifling actions क्या क्या है? What do you mean by bolt action? What do you mean by pump action? Especially this semi-automatic. Example of semi-automatic. Example of semi-automatic gun.
Many guns, M1 gun,
AK also is semi-automatic. Okay. Now what do you mean by ballistics? Total ballistics अगर मैं देखो, ballistics is nothing but motion of projectile, study of motion of the projectile. Interior, exterior, terminal. Interior means what? Whatever is happening to the bullet inside the gun. Inside the gun. That is interior or proximal ballistics. Okay? Barrel से निकलने के बाद in the air air. I am shooting you. So whatever is happening in the gun, that is interior. निकलने के बाद, before striking you, the air में जो different changes हो रहा है, that is exterior or external. Target strike करने के बाद, for us with human beings, what are the impact on the target? That is terminal. We are dealing with terminal. We are not concerned with what is there inside the gun. We are not concerned with what are the changes happening in the bullet. We are concerned that patient आया है with firearm injury. I have to save the life. I have to take out the bullet. I have to hand over to the bullet. So this is our role. Okay, we'll give information to the ballistic expert. Ballistic expert will do all this study. So this one, whatever is happening inside the gun, this is interior ballistics. Okay, going out. Now this is out. Now because of the rifling, there is spinning motion of the bullet. Okay, stabilization. Then for the piercing, that thing is required. That rotation is required. Then all these changes, these are all not our concern. Our concern is when it strikes the object, whatever is happening inside the body, human beings. Okay. Terminal and wound ballistic, this is our role. So to make it simple, this is interior, exterior, terminal. We will examine the body, we will examine the injury, we will give the findings of the injury, entry and the exit wound, what may be the probable range. We will give all this information to the ballistic expert, who will find out that bullet में क्या क्या changes था. From there they will find out what may be the probable gun which was used. Okay. What is your role? Fine. Okay. For now, you just remember how does the cartridge looks. Ammunition. This is for rifles. This one. These are all rifle firearm. For rifle firearm. This is the bullet. These are all different types of bullet. These are all cartridge. Okay. And this is for shotgun. This entire thing is of metal, brass. Okay, metal, brass. Here, this is made of plastic. Here is the metallic part. This here is made of plastic. Now, what is the content? You see, content there is to ask. This is for shotgun. This is for rifle. Okay. At the bottom, both has the primer. What do you mean by primer? Primer के बाद होगा gunpowder, powder charge. That is the gunpowder. Okay. Then one difference is in shotgun you have this plastic thing that is known as the wad. This is not there in rifle cartridge. Wad. Wad के बाद होगा, this will be pellet. It is written wrong here. This is bullet for this one. For this it will be pellets. Okay. You might be asked to draw a diagram of this or this. So, see this one, if I get an injury wound, I will say that this is from distance, because there are some features which will say that ये दूर से किसी ने गोली मारा है. Similarly, if this comes, then I will say that इतना दूर से नहीं, थोड़ा पास से shot किया है, based on some features. Okay, tattooing, abrasion color, and all these things we will examine. This is the range which we'll see. Okay. This was one case of shotgun. These are multiple pellets which got stuck in the skin as well as inside the body. Okay, these are small balls. This one, small balls, pellets. Okay, so firearm, I have 2 videos to show after that class is over. This one is burn injury, dry hit. This one is scald injury, moist hit. This one is chemical, acid throwing, sulfuric acid. Okay. This movie, did you see? Vitriolage, based on acid throwing. Okay. So that's all for these slides. I'll show you the videos. of you look here. When you pull the trigger, this trigger will hit this is the firing pin, this one, firing pin. This is known as the percussion cap, okay? The end of this side of the primer. Okay, so this is the primer, this is the gunpowder, this is the bullet. So this is the primer compound. Primer compound. What is this compound? Short note. Primer compound. Then foil paper, Avil. Foil paper क्या करेगा? Not allow this primer compound to get spread in the surrounding areas. Okay? This will make sure that the primer compound is here. इसको इधर ही रहना है. इसको इधर नहीं आना है और पीछे नहीं जाना है. It should be here. So this foil paper prevents leakage of this primer compound. Okay? Avil. Avil का क्या role है? Avil you see it is pointed this side. This side. So ये जो primer compound है, it is getting pressure from this one by the firing pin, and because of this pointed area, this here, it is getting squeezed between this one and this one, right? Because of this, there will be a spark in the primer compound. There will be a spark. This spark will be passing through this hole, through this gunpowder. What are the types of gunpowder? Short note. This gunpowder will be burnt, gases will be formed, force will be generated. This force will take out the bullet. Okay? Now this is the gas, the pressure, it will take out. And this one, few of the energy will be going back. And this will be used to take the next cartridge. So this is the next cartridge which is used. So you don't have to prepare the gun again. The same energy is used to take out the next cartridge. Example of which type of gun? Semi-automatic. Very good. So इसमें एक lever mechanism है. If you activate that lever, this semi-automatic becomes automatic. Okay. So automatic कैसे cartridge उड़ता रहेगा, automatic fire mode उड़ता रहेगा, and continuously the bullets will go out. Okay. Now the last is this shotgun. Shotgun, all these things are preparing the shotgun, cocking of the gun. The mechanism is almost same. See, this is the trigger. This is the trigger. This is the firing pin. This is the percussion cap. Here also inside primer will be there. Primer, gunpowder, wad and pellets. Okay. Now primer, same thing. उस bullet में जो है, here also same thing. What is the function of this wad? Silence. What is the function of this wad?
This separates the shot
from the gunpowder. क्यों? बाकी चीज क्यों नहीं रख सकते? You are some 70% correct. Separate करता है. Why this separation is important? Previously there was bullet. Okay, so that bullet will take up the entire space. Here it is small balls. So there will be some spaces between these balls. So if this one is not there, these gases which will be formed here, all these gases will be leaked through the spaces between these balls. So force generate नहीं होगा. So this one is kept in the middle so that no gases should leak from here to through the spaces. This prevents those leakage. Okay, इसका तो structure almost same है. Priming compound, paper disc, Avil, hole cover, battery cup. Then strike करेगा, spark will be generated. Here the gunpowder will burn. It will not allow this one to go here. एक साथ जाएगा, जाने के बाद the pellets will disperse and this wad will fall on the crime scene. So shotgun के लिए we are supposed to get the wad in the crime scene, plastic wad मिलेगा. Okay.